Hi, this is Dr. Rob coming to you with your weekly health blog. And last week we talked about the Drug Awareness Week, and that was going on in all the local schools. And actually there's a few schools that are having it this week too. So we're going to continue on the DARE or Drug Awareness Week here. And I just wanted to talk about this interesting survey that came out that was talking about prescription drugs, because last week we were talking about the legal drug cartels. Well, this came in, and it was from the National Health and Nutritional Examination Survey, and it was done over a course of a whole decade. And they came up with the statistics over the last 10 years, the amount of Americans that took one prescription drug in the last month. It went from 1999 is 44% to today about 48%. Also, the use of those people that use 2 or more drugs increased from 25% to 31%. And the use of 5 or more drugs increased from 6% to 11%. So really, and also is really interesting is what they talked about was in 2007, 2008, 1 out of every 5 children and then 9 out of 10 older adults had at least 1 prescription drug in the last month. So the business of prescription drugs in a recession is actually booming right now, and it's because of our drug mindset culture that we're talking about. So the total prescription drugs, so spending on prescription drugs in 2008 was $234 billion, now, which is double from 1999. So another study came out, which is interesting, because there's a potential solution to this. Now, the Journal of Manipulative Physiologic Therapeutics in 2004 came out with a study, and this study was talking about when they revealed that after 4 years and over 22,000 patients, they demonstrated a 51.8% reduction in prescription drug costs. And what they did is they basically directed care towards chiropractic, and the chiropractors would direct care out. So it decreased dramatically, and then if you extrapolate that as far as that 51.8% over the course of all healthcare, it would have saved the U.S. healthcare system about $121 billion just by that. So it's really amazing to think about that just by redirecting, and so people are focused on drug therapy, that such a huge change can happen in just the cost of healthcare. So I wanted to bring that particular thing up because really I'm not trying to say that medical doctors should be booted out of the primary care position. I think they should continue to stay on as primary care physicians, but I think that the way it should be thought of is that when we go in to see our primary care physician, when we have a certain complaint, the doctor should look at it, and we should only take those medications in emergency situations, because that's what they're designed to do. They're not designed for health type of situations. Then if it's no type of medical emergency and the doctor rules that out, then just go and see your chiropractor and continue on building your health through receiving adjustments that allow the internal mechanisms of the body to actually enhance and allow the body's the internal mechanisms to work the way it's designed to do. Because the body works well if there's no interference, and that's the job. And when we correct spinal subluxations, allows the body to work at its own potential, at its optimal potential. So if you have any questions about what we're talking about, you can always contact us at Bates Chiropractic at 310-545-4188, or you can contact us on the web at chiropractormanhattanbeach.com and check us out there. But also, this is a big message, because if we can just get the word out, and if people start working and start changing their attitudes on how they start taking care of themselves, especially when they start getting certain ailments that come up, you can really affect the whole healthcare system. So if you can spread the word to other people, you can probably save a life. So refer people to this website, pass on this video blog to other people, and we appreciate you. Keep spreading the word. Have a great day.